welcome to Docplexus News. Let's discuss this week's healthcare headlines that matter. The Union Cabinet has now cleared the proposal for setting up National Testing Agency to conduct NEET biannually. According to the sources, the decision is taken to relieve the burden of CBSE. The new agency will likely provide hands-on training, especially to the rural students for taking online tests. Now, the pharmacies in Andhra Pradesh will accept only the e-prescriptions generated by Comprehensive Drug Monitoring System. In a unique initiative to combat reckless prescriptions from quacks, 64,000 registered doctors in Andhra Pradesh will register in this e-prescription system. This system will also prevent antimicrobial resistance due to irrational prescriptions and generate electronic health records. To meet the shortage of doctors, the Maharashtra government has launched an incentive-based scheme to encourage specialists for serving in rural areas. Under this new scheme, gynecologists, pediatricians and anesthesiologists will be offered 50,000 basic salary and additional remuneration per case. These doctors will be required to run OPDs, take ward rounds and attend emergency calls during duty hours 6 days a week. The Kerala government has increased the retirement age to meet the shortage of experienced doctors. The Chief Minister's office has declared that it will be raised from 56 to 60 in Health Department and from 60 to 62 in the Department of Medical Education. Before this decision, the retirement age of doctors was higher in most other states than Kerala. As per the revised hypertension guidelines by American Heart Association, 130 by 80 mmHg is now considered as high blood pressure. The revised guidelines suggest that blood pressure of 130 by 80 mmHg should be initially treated with lifestyle changes and medications. It further states that the BP should be confirmed with at least 2 to 3 readings taken on 2 to 3 different occasions. The new guideline has eliminated the pre-hypertensive stage. The FDA has approved first pill with a digital ingestion tracking system for the treatment of schizophrenia, bipolar I disorder and depression in adults. These aripiprazole tablets have an embedded ingestible sensor that tracks ingestion of the medication. Although this system will help in medication compliance in mental illness patients, it is not approved for patients with dementia-related psychosis. Following the long-standing demand by government employees, the Haryana government is going to launch a cashless medical facility for all its employees and pensioners. In this scheme, medical bills up to 5 lakhs will be paid by the government at 67 government hospitals and medical colleges. This initiative will cover cardiac conditions, brain hemorrhage, coma, accidents, dialysis, CT scan, MRI and cardiac catheterization lab tests. Indian population living in remote northeast region remains deprived of crucial medical care due to inaccessible hilly areas. The Union Ministry of Development of Northeast is all set to establish India's first air dispensary to meet the healthcare needs of this region. This helicopter-based air dispensary would be based at Imphal in Manipur and Shillong in Meghalaya. This project will be started from beginning of 2018 and the ministry has contributed ₹25 crores for this project. To reduce deaths caused by accidents, the Health Minister Mr. J.P. Nadda has announced to set up 35 new trauma centers. The Union Health Ministry estimates that India accounts for 6% of total road accidents in the world, with having only 1% of total vehicles. In view of this, Health Minister said that there is a need to create enhanced healthcare capacity and roadside facilities in the country. The severe air pollution in Delhi has brought everyone's attention back to one of India's biggest health hazards. To deal with this public health emergency, the Supreme Court has demanded an all-India plan from the Environment Pollution Control Authority. In this regard, some hospitals are distributing N95 masks to high-risk patients with lung and heart diseases. We urge our community to give your valuable suggestions for managing hazardous effects of air pollution in high-risk patients. These were the latest happenings in the medical field brought to you by Docplexus, India's largest online community of doctors. Stay tuned for more every Thursday at 6 p.m. Happy Docplexus!